So if you look at Adele, what's happening, she's lost that beautiful contour that she had and it's all dropped down. She looks older.
Yeah.
And because she's done it so quickly, her skin quality's also changed as well.
Hello and welcome to House of Influence. I am Talina and I'm here on the sofa with Dr Chike.
Thank you.
It also sounds a bit like cheeky. And you are cheeky.
I am a little bit. I
would say that's an understatement.
No, it's fine. You know, people.
I've met you for 5 minutes. I would say you're cheeky.
Thank you, thank you. Well, it's a pleasure to be here.
Yeah, good. Well, it's a pleasure to have you.
Thank you.
So, you are the master of the non-blade facelift. Is that accurate?
I do the non-blade facelift.
So, how would you describe yourself then? Because you're not a plastic surgeon, are you?
No, I'm not. I'm a non-surgical aesthetic doctor. My background is, actually I used to be an orthopaedic surgeon back in the day.
Feet?
No, bones.
Oh, I was going to say, I really don't like feet. So that's all right then.
Yeah, no, I used to be an orthopaedic surgeon. That's my background. And part of my surgical training, I did do plastic surgery.
Right, okay.
Okay, so I was involved in sort of, you know, cosmetic plastic surgical interventions.
Yeah.
Then I left orthopedics in about 2012. I worked in the private hospital for about 4 years, and then I entered the world of aesthetic medicine, so non-surgical aesthetics.
So what would be an example of like a non-surgical aesthetic treatment?
So, I mean, in the public domain, most people would talk about, you know, Botox and fillers, you know, in the sort of simplistic terms. But for me, it's more about facial rejuvenation, body contouring, that sort of thing. So all the complex treatments.
Body contouring. Tell me a bit more about that.
So for me, you're using non-surgical things like fat dissolving agents, you know, liposuction. But my main work on a daily basis is the face, the sort of complex facial aesthetics. Okay.
So what kind of treatments do you do?
So simple treatments, you know, anti-wrinkle, the Botox, dermal fillers, but complex dermal fillers. So I'm talking lots of volume, restructuring, transforming the face, that sort of thing, changing profiles, and then using what you call, you know, the non-blade facelift technique. So that's PDO threads. Okay, to sort of change the structure
like
and lift
threads.
Inserting threads to lift up the tissues and change sort of alignment as well.
Does it hurt?
Nothing's pain-free, but certainly it's not as painful as surgery. There's less downtime. It's cheaper. You know, and it's more acceptable.
Can you do it on yourself?
I can't do it on myself, no.
That's a shame, isn't it? I'm not saying there's anything wrong with you.
Interestingly, a lot of my colleagues actually do the sort of anti-wrinkle Botox treatments on themselves.
Right, okay.
Yeah, but not the dermal fillers.
Fair enough.
Although actually on YouTube there is someone who does lip filler on themselves and it goes a bit wrong.
Talking of which, have you ever had any treatments that have gone wrong?
For me personally, on clients and patients. So, I mean, coming from an orthopaedic background, you're always going to have, you know, complications. That's what you're going to have to counsel all your clients about, or your patients about. I haven't had anything major. I've had maybe a little bit of asymmetry, swellings. Yeah, you know, one side's a little bit bigger than the other. And remember, when you start off, obviously you're quite junior. You know, you got to, you know, you get better with numbers. Yeah. So the more cases, the more procedures you do, the better you get. So when I first started, I must say, I look at some of those photos and I sort of cringe. You know, not as good as they are now.
Do people ever come back to you afterwards and they're like, "What have you done to my face?"
No, actually, interestingly, most people just like what you do because they don't look at it so critically, if you see what I mean.
Okay.
So I'm always trying to improve, you know, so I'm always like, oh, yeah, kind of improved, not as good as it should have been, but they don't notice, do you know what I mean? So most people, they just come and they just want big lips and they get big lips and they're happy.
That's it, yeah.
You know, but actually you could have improved the shape, you could have increased the ratio, the alignment could have been better.
There's a lot more to it.
Yeah, there's a lot more to it if you're quite critical.
So do you find yourself, like, when you look at people, like, really analysing their faces?
It's really bad because obviously, like what happens now, I'm at that stage, I've been doing this for about 7 years.
Yeah.
So I will walk into a room and I will, oh, okay, she's had this done. All right, why did they do that? Like, not in a bad way, but almost kind of, it's part of my learning, you know, sort of, why have they done that? Okay, what would I do different? What's the challenge for me to make it better? Do you see what I mean?
So, what would you say about my face?
Oh!
I'm actually terrified. Yeah, it's perfect. Anyway, moving on.
Yeah, exactly. There you go. Done. Okay.
No.
I mean, okay.
Have you got a little pen?
I have. But the first thing, actually, importantly, is it's not what I think. It's actually what you think. Do you see what I mean? It's like so when someone comes and consults with me, the most important thing is, what issue are you having with your face?
Yeah, okay.
Because if I don't address that when I treat them, then however good my work is, they're always going to be unhappy. So if you don't address that single question, that's it. It's not a good result.
Okay, yeah. So just to rewind then, when somebody comes in then to you and they say they want work done, what is the process?
So for me, it's okay. So how did you find out about me?
Yeah.
What are your hopes? What's the issue that you have? And then actually what tends to happen is they go, well, what do you think? That's when I'm really happy. Yeah, when they say, okay, you know, I love your work, what do you think? And then they've given me the sort of, almost the sort of, permission to just do a whole facial assessment and see how I can improve. And then once that's happened, then I go, right, okay. So then what I do is I split the face into thirds. Yeah, so from here to here. Okay. Here to the nostril, here to here. And also I look at the halves as well, okay? So what am I looking at? I'm looking at, well, what I need to know is your age, all right? Because invariably what I'm asking myself is, how are you aging? Right. Yeah, and have you got visible signs of aging? Do you know what I mean? Because actually I think the most beautiful people are the people who, basically, the signs of aging you get rid of, you soften them. Does that make sense? Yeah. So my goal is to reduce your signs of aging, so that when someone sees you, they can't tell your age, or you're always younger. Yeah, right? That's the goal. Sure. Yeah. So then we look and we go, right, okay, so this is your upper third. This is mostly anti-wrinkle treatment. This is lines we're treating. The most interesting part of someone's face is actually here to here, the mid face, because actually it's your eyes, isn't it? But people are drawn to your eyes. Yeah. So what am I looking at? I'm looking at asymmetry of your cheeks, the volume. Right. Okay. I'm looking at your tear trough area. Okay. That's a big sign. Okay. If you've lost volume here, how deep these lines are, the nasolabial folds. Okay. The contouring of your lateral cheek. Okay. So I can tell which side you sleep on depending on how much volume you're losing.
Which side do I sleep on?
It's difficult because actually you're aging quite well.
Yes! It's because I'm Indian. It's because I'm Indian. That's why. And I meditate.
Excuse me. Are you being racialist?
No, I'm allowed to be. I'm allowed to talk about Indians because I'm Indian.
Okay.
Just saying.
Okay. So looking at you, actually you're very good because you don't have a tear trough, you know. I do look at the nose as well from the side, okay?
What's wrong with my nose?
No, it's fine. But what I'm looking at is the alignment of the nose, the mouth, and the chin, okay? And that's what we work on sometimes, and we call that profile balancing. Right, so what would you profile balance about? So with you, actually, I look at you, and then this line here shows that if you said to me, oh, I would want a bit of chin filler, I would say, yeah. Because actually what would happen... my chin's
not reaching my nose.
Yeah, well, it's kind of slightly set back, you see. Right. So I could actually augment your chin, bring you out a bit forward. Now,
or you can make my nose smaller.
So that's interesting because it's an aesthetic thing. We actually make the nose bigger, but it looks smaller because it's straighter, yeah. Oh. So we bring it up. Right. So we bring it up, straighten it, define the tip, and it actually looks smaller, although it's bigger. It's an illusion thing. Right. Yeah. Wow. Yeah. It's like Sigmund Freud kind of thing. Yeah, I like that. You are. A bit off-piste, but I like it. You're a modern-day Sigmund. Hello, Sigmund. Thank you. Okay, yeah, right. So, and then the other thing, the common things that people are now asking for is the chin and the jawline. Right, okay, and more contouring, more sort of angular, contoured, and Now I want to kind of touch on social media because obviously now on Instagram there's a lot of filters, a lot of face filters, and then we're also always seeing people like Kim Kardashian and all of these like celebrities like Bella Hadid, Kylie Jenner, who've clearly had surgery and saying they're not had surgery, blah blah blah. Do you think that's kind of making more business for you because people are being like, oh, I want to look how the filters look, or I want to look how Bella Hadid looks? Okay, so in terms of social media, you have to almost go back to, let's say, when this all started, like, you know, in 2005, 2007, there was all the sort of, the influencers there were more like the sort of, you know, David Beckham's wife, all these types of people. Okay, so they weren't, the, it wasn't Instagram. Yeah. Okay, and in those days, people would get stuff done, but they wouldn't admit to it.
Right.
They wouldn't say anything. They'll be like, oh no. But now what's happened with social media, Kylie Jenner, etc. Their program was great because I get lip fillers, I get this done, I get bum, you know, they're open about it, and clearly that has what's driven, you know, what we do basically. So it's more acceptable.
So you think that social media is actually positive because
it's
making it acceptable?
Well, it's double-edged, isn't it?
Yeah.
So now it's now moved on to the Love Island, you know, sort of people, and so lots of people now, young people are like, oh, you know, they're seeing it all the time, so they're more suggestible. Yeah. And so that's the downside to it.
Yeah, because I think that, especially with Instagram filters and stuff, like it is considered. Well, it's like, oh, this is the better version of me, and I want to look like this, and I want to change this about myself.
Absolutely, yeah.
There's also, I think, a stigma around having like surgery, whether it be plastic surgery or non.
Yeah, I mean, I think it's interesting because yes, there is, but actually, clearly, it's diminishing. You know, because actually on Instagram you look at all the people are showing what work they're having done. So that's not an issue anymore as much, and people quite happily talk about their Botox treatments. Yeah. You know. Why do you think it
was? Because I do think, like, I definitely think it's less of an issue, but it's still a bit like, oh, some people don't want to say.
It's about, I suppose, some aspect about confidence, isn't it? It's like, you know, there's this sort of thing that you've got to, you know, your face is, you should have your own confidence. You shouldn't need to do work to instill some sort of, you know, sort of some help towards that, I suspect. So, but I don't find it it's not a problem. I think most people are quite open now about it, and I treat people in their 70s. Yeah,
true.
You know.
Do you have to be careful though with people's like mental state?
Absolutely. Yeah, no, that's a big thing. And actually, in the recent year, that's actually a big issue. So body dysmorphia, body dysmorphia syndrome. You've got, you know, depression. There's people who are sort of going to these non-surgical treatments because they've got issues and they think that they're going to spend a lot and be happy. It doesn't work like that. So clearly for us, we have to screen them, and there's like screening tools that we use to, you know, sort of find out, you know, people at risk. Yeah.
So you have to, like, it is important to do like mental health checks.
Yeah, the consultation is so important. For me, that is the most important bit. The treatments are quick, but it's finding out about the patient really important. And if I feel that they fit, you know, they're in that situation, I don't treat them. Yeah. Just refer them back to their GP. You know, I'm a GP as well, actually. By the way.
Man of many talents.
Refer them back to myself.
Yeah, come back to me.
Come back to me in the NHS.
In another office.
Yeah, absolutely. Less shabby office.
I also, when I was doing my own research on you, kind of found that you'd spoken a bit about Adele and the fact that she'd lost a lot of weight, and because a lot of people be like associate weight loss and be like, yeah, I'm losing weight, so I'm looking better, and actually you were saying it's not always a good thing.
Well, again, a lot of these things it's difficult because your face has got volume, it's got collagen, it's got fat, it's got a structure, it's got bone, So as you age, you're going to lose some of that, okay? And that's what happens. The sort of curtains fall down and you get that heaviness. If you lose weight and you're fully bodied, you're going to lose that collagen, you're going to lose that fat, you're going to lose those supporting structures, and so actually what happens is you start mimicking aging. So if you look at Adele, what's happening, she's lost that beautiful contour that she had, and it's all dropped down. She looks older. Yeah. And because she's done it so quickly, her skin quality's also changed as well. Yeah. And so that was the premise of that paper.
Yeah, because I think it's good to know that, because so many people think that losing weight will make you look more beautiful, and fair enough if it's for health reasons or whatever, but actually your body is meant to be a certain way to keep you youthful and keep you
so do you remember Paula Radcliffe, the marathon runner? So when she was running marathons, she was quite gaunt, wasn't she? But when she stopped, like 3 or 4 months later, she was fully bodied, you know, more beautiful. Yeah. And that's just, you know, that's just simple sort of physiology, basically.
Yeah, for sure. Now, finally, before we move on to the last bit of our chat, I want to ask you, have you got any tips for anybody that's contemplating surgery?
Yeah, so I would say do your research, okay? Right. There's a lot of people out there who are injecting, and in fact I was reading some statistics the other day, about £29 million last year was spent on trying to correct treatments. Really? Yeah, this in the NHS. So I would say that it's really important to do your research on the person, okay? And what tends to happen, a lot of people go from injector to injector. You need to go to someone who's experienced, who can sort out any complications, and you can stay with them, and they just do little treatments over time, rather than these massive treatments that you get, and then you go to someone else who does completely different treatment and messes your face up, basically. So go to someone who is registered with a accredited organisation like Save Face. Make sure that you know about their background, then make sure they're medical, make sure that they have insurance, and obviously see their work. you know, and have a full consultation. And also the thing is, you want to go to someone who looks at your face globally, not, oh, I want lip fillers and just does your lip. You want someone who's looking at your face and able to assess you properly. So that's my tips, basically.
Okay, great. Thank you.
Thank you.
Thanks for my face assessment as well. Feeling quite good about myself after that. So I've got some house questions which we ask all our guests, and I just want you to answer with kind of like something short, first thing that comes to mind. So, out of all the influencers that you follow, who are you most inspired by and would recommend us and our viewers to follow?
Oh God, I've got a few, haven't I? Well, I work with this amazing injector, Dr. Zach Ali. He's, I've known him for about 5 years, and we train together. He runs a training company, Talina Medical in London. He's a fantastic inspiration, and he does amazing transformational work, you know, facial aesthetics. Another guy, Dr. Esho, he's quite a big name in aesthetics, and I like his sort of Instagram, his profile. I like the fun aspect that he brings to it.
Nice, so, yeah, that's nice. And what do you love and hate about social media?
Ooh, social media is hard work.
Yes, it is.
So I hate that fact, but you need to have a presence. I love that actually I'm finding myself being more and more creative as I do it. And it's quite fun as well. So I'm learning to, you know, edit videos and show my work, and that's really important for me. You know, and
for your clients.
Absolutely,
to see what you've done.
Absolutely. Yeah.
And what about a bad thing? What do you not like about it?
Well, I mean, I suppose it's. I mean, recently you've got the sort of rise of the celebrities, you know, Love Island injectors. You know, that's a bit of an issue. It kind of gives the appearance that you can just do a 2-day course and start injecting into someone's faces, which actually is not how it works. Right. So, and that's a recent thing. So.
Okay, and then have you got a bad habit that you're trying to give up, even though you are a doctor and you know doctors are angels?
Okay, my bad habit is I go to bed really late.
What's really late?
Like at 1.
Oh.
Yeah, so it's bad for your eyes.
It's bad, yeah.
And I don't drink enough water.
Okay. I thought you were going to say I don't drink enough alcohol. I was like, funny. All right, and finally, do you have a celebrity or influencer that you'd like to take on a date, and where would you take them? Ooh,
a celebrity influencer who'd like to go on a date. Adele. No, she wouldn't come, would she?
No, she wouldn't. But if she did, where would you take her?
I don't know. I don't know.
To your clinic to boost her face up.
Don't say that.
Oh, well, thank you very much.
No, thank you. That was fun.
I hope you've enjoyed our chat.
No, that was great. That was great fun.
You've really, like I said, made me feel good about my symmetrical face.
Stop it.
Stop it. Oh, okay. Thank you so much, guys. We hope you've enjoyed being on the sofa with us. We are Hoy on Instagram. And where can we find you on Instagram?
So I am at Dr Chike Clinics on Instagram, and also I work at Hampstead Aesthetics in West Hampstead.
Perfect. Thank you.